Hi there. Tonight I'm going to talk about estrogen dominance, a very important topic. It affects many women and men today. So I'm going to go through the symptoms, what estrogen dominance looks like, and some of those symptoms might be familiar to you, or some of the conditions that you have can be connected and caused by estrogen dominance. And then I'm going to go through what causes estrogen dominance. So it's super important, and again, women and men can be dealing with estrogen dominance, and unfortunately it's linked with many conditions that are from conditions of the immune system, or conditions that are linked with hormones, such as different cancers. So again, thank you for watching, and if you just joined or you're watching the replay, I'm Dr. Glenna, naturopathic doctor, mother of 3 kiddos, and my passion is helping men and women get healthy, because I know when men and women get healthy, children, families, and communities get healthy, and that's when children, families, and communities thrive. So thanks again for joining. If you know anybody that you think would benefit from listening to this video on estrogen dominance, please tag them or share, because you never know who might be dealing with some of these symptoms, and not knowing where those symptoms are coming from or what's causing those symptoms, and they might not know that they have control to get rid of those symptoms and to address the root cause. So please do share if you'd like to. So let's talk about the signs of estrogen dominance. First and foremost, migraines and headaches. And sometimes we're not aware that the migraines and headaches can be coming from estrogen dominance, because they might not seem like they're cyclical, they might seem like they're sporadic, but it could be happening before your time of the month, after your time of the month, before ovulation, and after. So even though they're not exactly just monthly, it can still be happening because of estrogen dominance. Super important, and migraines or headaches can be caused by hormone imbalances like estrogen dominance. So tendency towards toxic fat gain is what we call it. So it's fat gain that's around the middle, the midsection, or the hips. That's where we most commonly store excess estrogen. So other symptoms are water retention and bloating, PMS, heavy periods, mood swings, depression, poor concentration, spider veins, varicose veins, cellulite. You're at an increased risk for breast and uterine cancer when you have estrogen dominance. So super important. If you've been getting abnormal PAPs, cervical dysplasia, that's estrogen dominance in the body. You might have low sex drive, you might have endometriosis. Those are all linked with estrogen dominance. So I'll go through those again. Headaches, migraines, tendency towards fat gain, not being able to lose that fat, water retention, bloating. If you've been diagnosed with fibrocystic breasts, if you repeatedly going for mammograms and they're negative, thank goodness, but because you might have been told you have lumpy breasts or fibrocystic breasts, then they're hard, and practitioners are having a hard time deciding if it's breast or not, and they're sending you for mammograms just in case. That's estrogen dominance. That means you have excess estrogen in your body, and that's reaching those breast receptors, causing the breasts to get more dense. So it is linked to excess estrogen dominance, which can be linked to breast cancer. So super important to do something about that. Sooner rather than later, or if you have been diagnosed with breast cancer, you can still reduce the recurrence and reduce getting either a new case or a recurrence of the breast cancer. So cellulite, spider veins, hypothyroidism can be linked, because estrogen blocks one of the thyroid hormones, so it can cause hypothyroidism. So super important, and this is important for women from puberty right through to menopause. And men too. Men are now, what their estrogen dominance looks like is usually they're more linked or at risk for prostate cancer, and they usually have lower testosterone. So both men and women will experience lower sex drive if they have estrogen dominance. Endometriosis, abnormal PAPs, mood swings, super important, depression and poor concentration, increased risks of autoimmune disease, and increased risks, like I mentioned, of breast and uterine cancer. So let's talk about the causes of estrogen dominance now that we've gone through all the signs and symptoms of estrogen dominance. So the causes, as you might have guessed, is taking oral synthetic birth control, because you're putting excess amounts of birth control. Even low estrogen birth control is still higher than the estrogen that we can actually produce as humans. So our body isn't quite equipped to deal with large amounts of estrogen. But when we go through what you can do, if you are on the birth control pill, super important that you put some of these suggestions into practice to help your body deal with that extra estrogen. So besides the birth control pill, things called Zen estrogens, which mimic estrogen in the body. They act like estrogen and they go on our estrogen receptors. So pesticides, which is why it's super important if you're not eating organic food or you can't afford it or you don't have access to it, at least wash your veggies and fruits either with the vinegar rinse or those veggie washes that you can buy at the grocery store, and put them in your water, soak them for 5 minutes, and that will reduce the amount of pesticides that you're taking internally. Cosmetics have some Zen estrogens. These are basically chemicals that act like estrogen in our body and go on our estrogen receptors. Pesticides, herbicides, and plastics, of course. So that's why we've heard in the last few years, super important not to be drinking out of warm plastic water bottles, because the plastic is going in that water and there's phthalates in there and they act as estrogen. They mimic estrogen. The other one is stress. Stress is super important and a huge cause of estrogen dominance. And some women might, if you look back at a few months when your cycle wasn't as nice or you had PMS, you can usually look back 2 or 3 months before that or even the month and notice that you've had more stress. Because what stress does is steal progesterone to turn it into cortisol, a stress hormone. So when we're stressed, we're telling the body we need to make more cortisol. So we got to make it somewhere, and we make it from progesterone. So you take that progesterone, use it up for cortisol to run from the bear, and you get left with less progesterone. So you might not necessarily have excess estrogen, but in relative, like when you compare them, you're having estrogen-like situation because you've stole all your progesterone to make stress hormones because you got to run from that bear. So you're left with an estrogen dominance, and that's basically hormonal imbalance. So whatever you can do about that stress is super important. Liver function. That's one major way. The biggest way we get rid of excess estrogen is through our liver. So if you're drinking too much alcohol, you're on loads of pharmaceuticals, you have any liver, fatty liver disease or any other abnormality in your liver function, your liver enzymes have been high in blood work, you might not be diagnosed with a liver condition, but if you've seen your blood work and you see 2 or 3 liver enzymes elevated even mildly, that is a red flag that your liver is starting to break down because it's overworked, and your liver breaks down estrogen. So take care of that liver. Poor digestion, so insufficient fiber, which many of us have a problem with because we're just diet and busyness. It's hard to get all that fiber in, and we're supposed to get 35 grams. So that fiber binds estrogen and gets rid of it through our bowel. So that's what's supposed to be happening. So any way you can increase your fiber is super important in terms of hormone balancing and helping all those symptoms I talked about, like cellulite and PMS and mood swings and links with breast cancer and uterine cancer. So apples, pears, carrots, psyllium, all of those ways to get excess fiber in our diet, and greens, of course, will help you decrease that estrogen, and then we'll get rid of those symptoms of estrogen dominance. So poor digestion, often the cause of that is imbalance of bacteria. So you want to make sure that you've got probiotics in your gut, because probiotics also decrease estrogen. So any problem with digestion, especially sluggish bowels, is going to lead to estrogen because you're not getting rid of and eliminating that estrogen like you should be. So super important. If you've got any symptoms like hypothyroidism, cellulite, mood swings, fibrocystic breasts, headaches, different times of the month, make sure you go and address the bowel function first, because if you don't have healthy bowels, you're not getting enough fiber, there's not enough good bugs, you're not going to be eliminating the estrogen properly, so there's going to be estrogen left in the body to keep recirculating and going on those estrogen receptors. Next one is alcohol consumption. I want you to think about that, and it's super great to be giving your body a break, especially after summertime, from alcohol, because even one drink has been shown to increase estrogen in the bloodstream. So if you are drinking and you have more than one, make sure the next day you do exercise, you make sure you get a salad in there, you make sure you're drinking lots of water in there to help your body eliminate that spike in estrogen that comes with alcohol. The reason why it spikes, one of the reasons, is because alcohol is keeping the liver busy, because the liver has to break down that alcohol, so then the estrogen can get backed up. There's a few other reasons why alcohol increases estrogen dominance, but that's one major one. Nutrition deficiencies. So not eating a whole foods diet may lead you at an increased risk of being estrogen dominant because you need magnesium, you need zinc, and you need B6. Those are the three most common. There's lots of other cofactors, but you need these three nutrients to break down estrogen. So if you are low in B6 or you are low in magnesium, you're going to be at increased risk of estrogen dominance, which means you are at increased risk of all those conditions that I named at the beginning of the video. So super important to either supplement those or get higher amounts of greens in your diet, which will give you those Bs, that will give you the magnesium. Get pumpkin seeds for your zinc. Just having a nice whole food varied diet is going to give you those nutrients and fill in the gaps so that you won't be nutrient deficient. And this does apply for men. Men do not want to be nutrient deficient. It increases weight gain around the belly, increases heart disease, and it increases your risk of prostate. So this also applies to men. So lack of exercise is a huge other risk of estrogen dominance. We sweat out estrogen, and as we're exercising, we're increasing circulation. So as we're increasing circulation, more blood is flowing through that liver. So we're detoxing at a greater, kind of more efficiently. More blood's going through, we're going through more hormones, breaking them down, getting rid of them, passing them on to the bowel. So exercise speeds all that up, besides sweating out estrogen. Super important. So 15, 20 minutes, you can get a sweat on. Even 10 minutes, you can go for an intense workout and help that whole process of excess estrogen dominance. Sleep deprivation, super important with leaving you estrogen dominant, because sleep, if you have habits that are causing you not to sleep well, eating large meals at night, having caffeine past noontime, what else? Watching TV right before bed, doing something stressful before bed, exercising too late at night. Any of those symptoms can cause, or the other one is not keeping your blood sugar level. That will cause you to wake up at nighttime. So if you're doing any of those habits and you're not sleeping well, you're going to have less melatonin, and melatonin protects us against estrogen dominance. So if you do have estrogen dominance, you've had any of the symptoms that I talked about, and the more symptoms you had that I talked about, like any abnormal PAPs, fibrocystic breasts, mood swings, headaches around your period or ovulation, water retention, spider veins. You can go through the beginning of the video for more of the symptoms. But if you do and you are not sleeping, you're not making melatonin in adequate amounts, so you're not protecting yourself against estrogen dominance. So that is why a lot of integrative cancer centers use high levels of melatonin to treat prostate, breast, and uterine cancers. So let me see what other things we should talk about. I think we covered everything I wanted to. Obesity. So if you are overweight, you will probably have an increased rate of estrogen, because estrogen is stored in fat cells. And the more fat cells we have, the more estrogen we've got in those fat cells. And then we usually have less of something called sex hormone binding globulin. If we have less of that, then the estrogen floating around our body is not going to bind. So that sex hormone binding globulin hormone binds to the estrogen. If you've got less of it, there's estrogen floating around and circulating, so more free estrogen. So some things to think about. Again, if you've got any symptoms of estrogen dominance, you really want to address it. How do you address it? The causes that I went through, having Zen estrogens in your environment, like plastics in your cosmetics, having too many pesticides and herbicides around that you're taking in, high stress, which is stealing all your progesterone, leaving you with progesterone deficiency, which is very similar to estrogen dominance, poor digestion, too much alcohol consumption, poor liver function, poor digestive function, because that's how we get rid of estrogen. You really want to think about taking care of that. So if any of those symptoms at all, and so what you do is flip them around, the causes I gave you. If you have those symptoms, think about nutrition deficiencies and fill in the gaps. Think about eating more greens, cruciferous vegetables, get those nutrients in. Start exercising, even if it's just 3 or 4 times a week. Address your sleep habits and get sleeping, which will give you more melatonin, which protect you against estrogen dominance. So I hope that helps. Super important, so please share this if you know of anybody dealing with those estrogen dominant symptoms, because we can do something about it. Many women have some of these symptoms. They don't know they can get rid of things like cellulite, spider veins, fibrocystic breasts. They wonder, is there a link with fibrocystic breasts and breast cancer? And there is. So, but you can do something about it. all of those symptoms and conditions you can do something about. So I hope you found this valuable, and I hope you learned a few things from it and empowered you. You feel more empowered that you can make a change in your own health. Take care and have an awesome sleep. Okay, bye.